You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Lockman. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 28-year-old woman presents with progressive depigmentation of her skin over the past 3 years. Physical examination revealed a well-demarcated milky white patches with distinct borders. Okay, so this is the presentation of the individual, and they were noticed, okay, largely on the hands, the feet, and the face. Now, the first question is that what is the most likely diagnosis as far as this patient's presentation is concerned? My friends, your answer is vitiligo. Yes, the reason is that now whenever we talk about vitiligo, we are talking about an autoimmune, disorder, which of course causes destruction of melanocytes of the epidermis of the skin. Now, one thing we understand is that if you look at the epidermis of the skin, yes, we have other cells. Okay, we talk about keratinocytes, we talk about Langerhans cells, talk about Merkel cells. But my friends, importantly, we talk about also the one who is responsible for producing, of course, the skin pigment by way of melanin, okay, being melanocytes also being present. Okay, so what is happening is that autoimmune disorder, yes, the own body's immune response has become so exaggerated, say that it's destroying these things. And understand, once this chronic, yes, it's going to be that kind of progressive, the depigmentation will take place gradually, and then with time will be seen in most of these areas. And so characteristically, whenever we're talking about vitiligo, by way of the depigmentation of the skin as a result of this autoimmune disorder, one thing is that yes, the characteristic things we see is that it's well demarcated. There are distinct borders, no doubt about that. And of course, it's this kind of milky white, patches that we see often will be symmetrical. Okay, will be symmetrical. So on either side of the body will be seen. Now, one thing I need you to understand is that whenever we talk about melanin, yes, there are two forms. Yes, although both of them, the amino acid that is needed for the production of melanin is of course tyrosine. And therefore, yes, it makes sense that we need another enzyme known as tyrosinase, okay, to help with, of course, the biosynthesis of melanin. Now we have eumelanin, which is of course the true melanin, and of course we have pheomelanin, which is of course not the true melanin. Now at the end of the day, one thing that you need to understand is that both of them, although will help shield the body or the skin, okay, against the harmful effect from the ultraviolet rays of the sun, one thing is that the eumelanin, which is the true melanin, does it better. Okay, and so the eumelanin gives us what we call the dark brown pigmentation. But the red yellow pigmentation, which of course we see it in individuals who are blonde, okay, will be of course the yellow red pigmentation that will be seen. Understand that melanin does not only impart color to the skin but also to your hair. Okay, so it's important. And so that is why I need you to understand that whenever you are, of course, getting rid of a lot of your melanin, okay, by way of bleaching, then what is happening is that you are exposing your own skin to, of course, the harmful rays from the ultraviolet, okay, of the sun. Okay, so you don't want that. And that is why you're supposed to maintain your natural skin tone as far as the color is concerned. So, these are the things that I need you to understand. Now, whenever someone presents with, of course, this hypopigment, this kind of depigmentation, understand that there's a thin line. Okay, yes, I should even say there's a clear-cut distinction between depigmentation as a result of this autoimmune disorder, which we are calling vitiligo, and of course hypopigmentation. In situations where there's hypopigmentation, then it tells us that the melanocytes are not making adequate, melanin. And so the skin becomes lighter. Okay, but this time around, we are talking about autoimmune destruction, which is resulting in some kind of, milky white patches, okay, which are well demarcated. Okay, distinct borders are present. Okay, that one is vitiligo. So understand that there's a difference between hypopigmentation and, of course, depigmentation, which is, of course, entirely different from hyperpigmentation. In situations where there's hyperpigmentation, that one, of course, there's more melanin production, and that one will lead to a darker, skin color or hair color. Now, understand that whenever these things are happening, it means the immune system has become exaggerated. Okay, it wants to combat some sort of pathogen or other things. And so, whenever the management comes in here, then there may be the need, okay, to talk about looking at what do you call it? Immunosuppressant, okay, will be something that can be given, okay, to suppress the immune system. The worst case scenario, if the person still feels that kind of stigmatization in the society, okay, after going through that kind of counseling, there may be the need for a surgical, intervention. Okay, so one thing is that we want to give something, okay, which will of course suppress the immune system, so that of course it minimizes the rate of depigmentation. My friends, I believe you find this concept helpful. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.